name is Aron Lazary. I'm a spine surgeon from Budapest, Hungary, and I'm the principal investigator from the National Center for Spinal Disorders. And we are a clinical partner in the METASTRA project, and our main role is the participation in the two work packages related to the clinical data collection, to the clinical studies. The one is the work package 2, which is about the retrospective trial, and the other one, VP5, work package 5, which is led by us, is about the prospective trial. And actually the main goal or the main target of work package 5 is to collect data which can be used for the validation of the METASTRA tools, the developed tools for the decision-making support. So the validation of such a computational tool is not easy, because we actually don't have standardized protocols or previous experience in the literature, so we have to actually develop the validation protocol and the method. But we know what we want to reach. We want to show that the developed computational tools can really help in the decision-making process for the surgeons. And to do that, we have to prove that, first, how reliable and how heterogeneous is the human decision-making process, and second, how precise the computational tools in terms of the prediction of fractures, for example, in the METASTRA study. So to fulfill this criteria or to reach these goals, we have to collect prospective standard data from real patients, and this is a key, because all of the models, computational models or other research models, are models which were developed in so-called laboratory environments. On the other hand, we have real patients and we have real life and social and economical situations, and health and patients' health is one issue, one really important issue in the patient's life. But the decision-making, the decision on the treatment can influence the whole patient life. So that's why it's necessary to show that in this decision-making, the computational tool can really helpful and can give a significant advantage for the surgeons and finally for the patient. For any kind of medical device or medical method or a new drug or a new treatment method, the basis is the scientific evidence on the use of the tool or the new drug or the new device. But the key issue is the implementation and the so-called spreading of the use of the new tool in the everyday clinical life. And so we can have a very good drug, but if the doctors won't prescribe the drug, the patients won't benefit from the use or from the drug. So also in case of the METASTRA project and the results of the METASTRA projects, from the very beginning, we are focusing also on the future use of the tools and the implementation, the deployment of the tools into the real clinical life and real clinical environment, which is changing. So 10 years ago, we had much less digital techniques and methods in an outpatient office, for example. Today we have much more, and we started to use artificial intelligence supported methods also in the everyday clinical practice. And in 10 years' time, we have again a changed environment. So we have to develop the METASTRA tools to fit not only the today's requirement, but the future requirements and also the doctor's need. And what we see as surgeons, that any kind of tool which can help for the patients are welcome, but on the other hand, these tools should be easy to use. Easy to use for surgeons who have limited time to learn a new technique and also to adapt and use a new technique for every patient. So METASTRA tools will be easy to use finally, easy to use also for a surgeon. And in that case, the scientific evidence and the scientific support included into the METASTRA tools can help for the patient and for the doctor to reduce the unnecessary surgeries and also to predict the fracture risk and to prevent a lot of fractures in the future.